Today we are doing spinal rotation and thoracic extension. So we're going to think about what we can feel connected with the ground. So we want feet to be feeling connected, equal from side to side. We want our lumbosacral junction to be feeling connected, which is the junction between your lower back and your pelvis. You want to feel the TL junction underneath the floor, underneath the TL junction, which is the junction between your upper back and your lower back, underneath both shoulder blades and underneath the back of the head. So we're going to go through some postural cues now just to get better connected. So think about your feet. If you're feeling that one side is pushing further, more onto the floor than the other, just play with shifting the weight in your feet. If you feel like the weight's more on the left, try and push down a bit more with the right and vice versa. And think about where you're feeling the pressure underneath your feet. So if you're feeling the weight more on the outside of your feet, try and just pull that inner arch down towards the floor, but without lifting that outer arch off. And say if you're feeling like the weight is more on the inside, try and just pull the outer side down without lifting the inner arch. And now should get your knees in a better position, so they're pointing straight up towards the ceiling without being sort of caving towards each other. And then we're going to work our way up to the lumbosacral junction. So what we want to do to get better connected there, we're going to tilt the pelvis in one direction. So this is an anterior pelvic tilt. And then we're going to posteriorly tilt the pelvis, anteriorly tilt the pelvis, posteriorly. So when we anteriorly tilt, we lift the spine off the floor, so you get this arch here, and then when we posteriorly tilt, we get this sort of the spine curving into the floor. So we're going to lift and lower, lift and lower, lift and lower, and then we want to stop in the midpoint between the two end ranges. And that should get your pelvis into a neutral position, and it should get your lower back into a neutral position where there's no gap underneath your back on the floor. So you shouldn't be able to get your hand underneath your back. So your back should be flat on the floor, so there's no curve, and then it's not reverse curve into the floor. So you should feel that your lumbosacral junction is better connected with the floor now. And then we'll work our way to the TL junction. So your ribcage and your pelvis, they want to be parallel with each other. So I can't do it this way. So imagine that your ribcage and your pelvis are like the pages of a book. And what we don't want are for the pages to be open. So if we're open, we're in this kind of rib flare position, we've got this lumbar extension. So we want to try and pull the pages together, like we're pulling the rib cage and the pelvis into a parallel position. And with that, you should feel better connection with your rib cage and with your TL junction and the floor. And then we're going to work our way to the shoulder blades. They should be feeling equal from side to side. And the shoulders themselves, they want to be neutral. So what we don't want is for them to be in this internally rotated, protracted and elevated position. We want to get them into a neutral position. We're going to slightly retract them, externally rotate and depress. So we're trying to bring the shoulder back a little bit, externally rotate it and depress it. So you're trying to pull the shoulder blade down towards your back pocket. And then we're going to work our way to the head. So the head wants to push right back down towards the floor. Look up towards the ceiling, so eyes keep pointing towards the ceiling. Don't let your neck go into extension. and don't let it go into flexion. So we're going to push our head back down towards the floor. And you should feel these muscles at the front of the neck working a little bit harder. So then we're going to just work on our breath. Now we're feeling better connection. Put one hand on the chest, one hand on the tummy. And we're going to just think about our breath and try and get our breath in the right order first of all. So when you take a breath in, the hand on the tummy wants to lift, and when you take a breath out, the hand on the tummy wants to lower. Hand on the chest doesn't want to move anywhere. So just focus on your breath, first of all, really thinking about what it's doing, thinking about trying to get this hand on the tummy to lift as you're breathing in, and lowering as you're breathing out. So if you've got this breath in the right order now, what we want to do is put the hands around the waist, because we want to try and get the 360-degree breath now. So as you're breathing in, your diaphragm wants to go, well, should go downwards, and that should create this intra-abdominal pressure the whole way around. So you should feel, as you're breathing in, all the muscles around the abdomen lift and expand the whole way around. So grab hold of your waist, grab hold of into these bony bits in here. And then what you want to do, so thumbs into the back as well. You're going to wake those muscles up so you know where they are. You're going to cough. Feel the muscles expand. And as you take a breath in, try and think about all those muscles now the whole way around. Lifting and expanding as you're breathing in, and relaxing as you're breathing out. So you want to feel it equal from front to back and from side to side as well. So if you're struggling with one bit, let's just start with the front. So give it a poke, give it like cough for a second, feel those muscles. And now think about those muscles, visualise those muscles lifting and expanding, pushing your fingers away. Grab hold of these bits into the side, now we're just going to poke them, think about those muscles. Breathe in through your nose, out through your mouth, through pursed lips, imagine you're blowing through a straw. Now grab roll round into the back, so into these muscles around the back. Cough again. Feel the muscles at the back expand. Breathe, expand. Imagine your back muscles pushing your thumbs towards the floor. Do a couple more breaths. Try and tie everything together so you're breathing all the way around. Okay. So now we've got the 360-degree breath. I want you to continue that throughout the flow. And then when we need to do something that requires more stabilisation, you're going to need to know how to brace. So when you want to brace, you don't clench or tense or suck the belly button in. You're trying to create an outward pressure. So you create a 360-degree breath, and then imagine that you're farting. So create a bit of an outward pressure as you're breathing out. So you're going to keep those muscles active throughout the breath in and out. Okay, so, and start the flow. So if you put your feet together, knees together, arms out to the side, we're just going to do some hip rotations. So we're going to let the knees drop one direction and head looks the opposite direction. And then when you're trying to bring your legs back into the middle, try and use these muscles here. So imagine you're trying to pull your rib cage down to the floor, and we're trying to pull the hips and the knees back using those muscles, and then we're going to go the other way. And then pull back. So we're going to look from side to side, drop the knees in the opposite direction. So alternating from side to side, nice and steady, feeling that rotation in the spine. Do one more each side. Okay, get your feet hip width apart, and then we're just going to float one leg in the air and lower. Lift the other leg, lower. Other leg, so we're alternating legs. Keep breathing. And now we're going to lift both legs. So I want you to create your 360-degree breath and your outward push and lift the legs. Try not to let the pelvis tilt anteriorly as you're lifting your legs. So lower, and come into a better position. Lift and lower. Can you see my head? Lift and lower. Lift, lower, lift, lower, couple more, and then we're going to finish with the legs up in the air in your 3-month supine position. And then drop your arms to the side again. And we're going to let the hips twist in one direction and head looks the opposite direction. And again, pull them back into the middle and go the opposite way. Do one more each side. And then we're just going to now take our hands into the air, lift your head slightly, look to the side you're going, and then we're going to roll onto that side. Try and control the movement, roll back into the middle. So make sure that your shoulders and pelvis are coming at the same time. So Lego body, don't let your pelvis lead and then shoulders follow. Nice and controlled, don't let your spine banana, so you've got a nice straight spine as you come all the way across. So we're going to roll from side to side. And then just do one more side to side. And then we're going to end up on our side. Arm out. Okay, head roll. And we're just going to do some spinal rotations. So hands closed, touching each other, palms face to face, or palm to palm, that's the one. So try and reach forwards past the bottom hand, and then you pull the hand back across the arm, across the body, down to the opposite side. Bring your arm over, so we're rotating. Feel that spine opening up. Let's do one more this side. And then we're going to roll back onto our back and then to the other side. And do the same on the other side. do one more this side. And then I'm going to roll onto my other side and do the right side first today. So we're going to come up into lower oblique sit, into high oblique sit, and then we're just going to twist. So hands flat on the floor, mermaid legs, shoulders active, don't let the shoulders just come up. So external rotation, depression in the shoulders, and feel that twist in the spine. You know, breathe into it. And now come down onto your forearms. Try not to let the upper back round, so you're going to try and make it a long, nice long spine. Feeling that breath in the abdomen. Come up into your oblique sit, and we're just going to put one hand on the floor, grab hold of the other knee, and we're just going to rotate round. And you're going to use that hand on the knee to give you a bit more of a twist, so it's like a counter rotation. And then bring the hand around the opposite way, so that hand goes to the back now, grab hold of the knee. And we're using that hand to push down to get you a bit more spinal rotation. Take your neck with you as well, so your head is actually trying to look over your opposite shoulder to get that rotation the whole way. Okay. Now we're going to bring the knees up to the ceiling. Take one leg straight and then twist into it. Take the opposite leg straight, bring that other leg up and twist. That leg back up, spine nice and straight, nice and long. Try not to let yourself flex. Nice and upright. And take the legs the opposite direction. And we'll just go onto our hands first of all. So both hands round, hands flat on the floor, spine's nice and long, don't round the back. Shoulders active. down into your forearms. Back up. Put that hand a bit further around here, grab hold of your knee and twist round. Now the other way, grab hold of your knee, hand down. Try and be nice and upright when you do this. Don't let yourself round because you're not going to get as much rotation as if you extend through your upper back. Okay, and now I'm going to turn round so I'm facing you. So we're going to be in this oblique sit again, and here. We're going to hinge forwards and lift up. Take that, I'm taking my left foot forwards into tripod, and then we're going to rotate up to the ceiling. And then down, rotate the opposite way. Back down, curl the back foot under. You're going to lift the knee off the floor, but keep that right hand down on the floor and then rotate up to the ceiling with the opposite hand again. Look towards the ceiling. And down into your high kneel. Keep your pelvis level with the floor. Try not to let your hip hike. So the side that where the foot's forwards, pull that down so it's level with the floor. And then just rotate around. And pull that back round. So you're going to grab hold of your knee on the inside now, and then look the other way. And rotate the right hand back round. And look towards your hand. Come up into this high kneel now again, and we're going to just stand from this high kneel, so curl the back foot under, and we're going to come up and take the right leg back, might just move, and lower down. Keep the knee tracking the second and third toe, don't let the knee collapse or go outwards. Try and keep the pelvis level the whole time, don't let it shoot out to the side. Lower, and as you're lowering down, again try not to let the knee collapse, try not to let your pelvis shift. So we'll just do a couple of those. Do one more. Bring this left leg back. Foot's getting stuck on the floor, into your oblique sit, and then rotate your legs to the opposite side. And then we're going to do the same again. So I'm going to turn around again. So I'm going to hinge forwards, lift, and then take the opposite leg forward. So now my right foot's forwards. Into your tripod, rotate up to the ceiling. And then opposite way. Down, left hand down, right foot forwards, curl the back foot under. You're going to lift that leg and we're just going to rotate up. And then down, handy up, pelvis level. You're going to twist around, grab hold of the knee. Pull that back, grab hold of the knee again, twist. Back round. And again, we're going to just stand a few times. So pelvis level, knee tracking, second and third toe, curl the back foot under. And I'm going to move these mats out of the way, because they're getting in my way. So, take that foot back, level pelvis, stand, foot back, pelvis level. One more. Level pelvis, knee tracking second and third toe. And then we're going to put the hands down into tripod, pull that foot round into bear and into quadruped. I'm just going to get the mat back now. So quadruped, down into low quadruped, and we're just going to work on the thoracic extension now. So we're going to tilt the pelvis backwards and forwards, find the neutral spine again, and what we want to do is try and get out of this thoracic flexion. We want to pull the upper back into extension, but without going into lumbar extension. So tilt your pelvis backwards and forwards first of all. Okay. Find your neutral spine in your lower back and neutral pelvis. Active shoulders, try not to collapse through here. Pull the shoulders into external rotation depression. And then with a neutral lower back, you're going to pull the upper back into extension. So imagine you're trying to pull your upper back down towards the floor and don't lose the lower back. If you feel like your lumbar spine shifts into extension, keep your upper back where it is and then just try and pull your pelvis into neutral. And we're just going to hold this position. Try to pull that upper back down into extension. Drop one leg back into 4.5 month prone. So the right leg at the moment on me is straight. This knee stays bent, hip stays bent. Forearm of the opposite hand to the bent hip and knee is pushing down onto the floor. And I'm just going to rotate up to the ceiling. And down, and then try and stretch and reach. And then rotate up. And stretch and reach. Rotate. Stretch and reach. Bring that right leg back in. Forearm, left forearm comes in. Take the left leg back. Left forearm stays flat on the floor. And then rotate up to the ceiling with the right hand. And then stretch and reach. Up. Stretch and reach. Up. Stretch and reach. Pull that hand back, knee back into the middle, and then we're just gonna stay in this low quadruped position. Forearms parallel with each other, and we're just gonna push straight in the elbow on one side, rotate the spine, and look towards the ceiling in the direction that where the elbows straight, lower down, opposite side. Feel that rotation in the spine, and just alternate between the sides. Let's do a couple more. And one more. Come up into quadruped. And again, we're going to work on neutral pelvis, upper back flat in extension. Try and mobilise through that upper back. Feel that extension in the upper back, feel that mobilisation. Breathe into it. And then we're just going to thread the needle. So we're going to rotate up to the ceiling with one hand and then come round, stretch it underneath the body the opposite way, up to the ceiling. And battery looks like it's going, so just, sorry, my battery's going to die soon, but we've got enough time to get through it, so don't worry. Up to the ceiling, through, up, through, up, and down. Do the opposite side. So, up and through. Let's do a couple more. And hand down. Now we're going to go find your neutral spine again. Make sure that you, before you go into bear, reset, neutral pelvis, upper back flat, and then you're going to curl your back feet under and take bum into the air. Try not to let the pelvis tilt forwards as you go up. So neutral spine, lift the bum, and then we're just going to rotate up to the ceiling. Hold that. hand down, go the opposite way. Down. Now we're going to hinge our hips backwards. So bum shift backwards, try and hinge the hip, not the lower back, walking into the squat, and then we're going to again try and rotate up to the ceiling. Hand down, try and go the opposite way. Hand down, stand up, and then we're going to go down to squat, up, down. When you're going into your squat, try and stay as upright as possible. Try not to let yourself round forward, so just try and keep that extension through the upper back, but don't lose it into the lower back. It's something I really struggle with because of my thoracics, my upper back. Do one more. And up. And then we're just going to keep the pelvis forwards and then just try and rotate the spine. Pull that back in. Pelvis stays forward. Rotate the other way. Pull it back. Just do a few more from side to side. And